important topic we are going to discuss is on catheterization. This is a very important skill, should be acquired by every interns during your internship. So these are the various types of catheter you are seeing here. This is a catheter made up of latex rubber. It is a very low quality catheter because it is causing so much of allergy. In many private hospitals, they don't use this. Most of the time, this is used in government setups only. So this is very easily available, very cheaper cost. This is latex rubber catheter. And you can see this is little costlier one, which is made up of silicone. This is silicone catheter used for. These are the various types of Foley's catheter you are seeing here. So this is latex rubber. This is silicone catheter. Don't forget these catheters. So and all the catheters you can see there is a color coding. You can see this is a color coding which is orange. This is green. Green is used in girls. Remember green for G, girls. Okay, it is 14 French size. It's a smaller one. You can see the diameter is very small. Okay, this is small. And in boys, we use orange, which is 16 French. It's little bigger than this. So if you see very closely, this is 16 French is smaller diameter. 14 French is smaller diameter. 16 French is little bigger diameter. So in simple, you can remember green is used for girls. Orange is used for boys. And this is a Foley's catheter. We are going to insert for a male urethra here. So please maintain complete sterile surrounding. So you should drape the area of the procedure. Don't touch anywhere else. Use a sterile gloves and take the catheter very carefully in a sterile way. And you have to put lignocaine jelly before inserting this catheter. You have to take the penis and insert with the syringe. You have to use a syringe to insert the lignocaine jelly. So we have to use this thing to insert lignocaine jelly deep into the urethra. And you have to hold it so that the lignocaine jelly will act in the urethra. Otherwise, it will be painful when you put the catheter. So to avoid pain while putting Foley's catheter and to have a smooth lubrication, we need to put lignocaine jelly first and wait. Hold it like this and wait for few seconds. At least from 15 to 30 seconds you should wait. So after waiting for a few seconds, then take the catheter and you should very carefully hold the penis perpendicularly up and you move it like this, move it slowly, don't push, just go smoothly. It will go smoothly unless there is any stricture or any slowly go inside. And you have to push the catheter up to this bifurcation. Don't forget, I have to push the entire catheter up to this bifurcation point. You should not inflate the balloons in the off the way. So in a male, especially in a male, you should put the catheter until the end. You should go deeper up to this bifurcation you should put inside. And ensure urine is coming out from this channel. After putting this, you should ensure urine is coming via this way. And once you see the urine is coming, then only you should take the syringe with the distilled water. 15 ml is taken for males. What is used for inflating the balloon is distilled water. Don't use anything else. We have to inflate the balloons using this lumen. So now I am showing you how it gets inflated. Please don't forget this is an inflation method. This is an inflation method. Let us see from this catheter how it is getting inflated. So after putting inside, we have to inflate the balloon. See how it gets inflated here. So when I am inflating, can you note the balloon gets inflated? This is inflated only with the distilled water. Don't use saline. Don't use air. Only with the distilled water you should inflate. This is a 2-lumen Foley's catheter. 1 lumen is to inflate the balloon. Another lumen is to drain the urine. So this is 2-lumen Foley's catheter. So don't forget, we have to inflate only after ensuring urine is coming out and you are fully inside until the bifurcation. Don't inflate before that. So this is a typical Foley's catheter and there are so many clinical questions from this. And for removing, I have to deflate the balloon. Now you see, I am deflating the balloon fully. So deflate the balloon fully, then only you should remove it out. There is a classical AIMS question for PG entrance exams. If the catheter is remaining inside like this, it is not coming out. I am trying to deflate. The balloon is inflated in the bladder and I am trying to deflate. It is not coming out means you should not pull. If you pull, this will come and damage the urethra. Urethral trauma will happen. If it is not fully deflated and not coming out, what are you going to do? So if the catheter is not coming out and not getting deflated, it is not getting deflated because that channel got obstructed. There are 2 channels inside, no? The inflation channel got obstructed. So what should I do in such case? This is a PG entrance question. Using ultrasound guidance, I should puncture the balloon. Using ultrasound guidance, you identify the balloon and go and puncture the balloon. The balloon gets ruptured or burst out, and then you can remove it. This is a classical question on how will you remove a retained Foley's catheter. Don't forget this retained Foley's catheter question. So the questions from Foley's catheter commonly asked in internship are: don't try to push the catheter forcefully. If it is not going freely, please remember you are encountering a prostatic hyperplasia or a urethral stricture. When you try to push it with so much of force, you can cause urethral trauma. Urethral trauma is one of the worst nightmares for the patient. Patient will land up in so much of future complications. So be careful. It should go freely. You should not injure the urethra. And most of the time, the urethra gets injured when you are going to inflate the balloon off the way. Without putting it fully, if you inflate off the way, it will be remaining in the prostatic urethra or membranous urethra, and once you inflate, that will rupture the urethra, causing more bleeding. Therefore, ensure completely it is inside like this. In fact, I will always say, ensure urine is coming out, then only you inflate. Without urine coming out, don't inflate. Urine coming out, and it should be at the level of bifurcation, is very important in a male urethral catheterization. So, male urethra is how many centimeters? It is around 20 centimeters. So, male urethra is 20 centimeters. It is having 4 parts: prostatic urethra, membranous urethra, bulbar urethra, penile urethra. So, if you inflate off the way, you will injure the urethra and you will have bleeding coming from the penis. Very dangerous complication. Be careful. Don't inflate off the way. So, what are the questions asked in PG entrance exam from this is, there are 2 types of Foley's catheter. One is latex rubber, another is silicone catheter. So, latex rubber catheter is removed and changed every 15 days to 1 month maximum. Whereas silicone rubber catheter, I can retain it for at least 3 months I can use this catheter. So, there is a difference. Silicone catheter has less allergy compared to latex rubber. And silicone catheter or latex rubber, whatever it is, the size and the color coding are same. If it is orange color, it is 16 French. It is used in males. If it is green color, it is 14 French, smaller one. So, it is used in girls. Don't forget these basic points about the catheter. Okay. This is a female patient we are going to catheterize. The same principles are followed. Maintain sterile precaution. And the only advantage in females is the length of urethra is only 4 centimeters. So, but don't think since it is 4 centimeters, you can put like this and inflate the catheter. So, female, we are going to use a green color Foley's catheter, and I am going to insert it through the urethra. So, in this area, you should understand there are 2 holes. So, one hole is above and below it is another hole. So, this below hole is a vagina. Okay, don't forget the below hole is vagina. The upper one is urethra. So, you have to exactly find the urethra and you have to insert the catheter. Okay, don't get confused and don't put it down. So, it is a vagina going towards the cervix. To identify, there are 2 holes. The upper hole is, you can see very closely, you can see there are 2 holes. One hole above is urethra, the hole below is vagina. So, you have to identify the urethra, and you can, in fact, like in males, we need not go to put the jelly inside. We can put the jelly in the catheter itself, just some 4-5 centimeter jelly, and you can go inside like this. So, in this case also, don't take a risk of, I have gone 5 centimeter, 10 centimeter, shall I inflate? Even if you have gone 5 centimeter or 10 centimeter, please push it fully until you go to the bifurcation. So, after you go to the bifurcation, then only you should inflate as usual. So, please remember, then you inflate as usual. What is the fluid used? It is distilled water that should be used to inflate. So, after inflating with around 10 to 15 ml of distilled water, you can just pull it so that you can find out it is not going to come out because of the inflated balloon. You can see it is not coming out. So, this is for females. In females, it is very rare to see a urethral injury. I have not seen anybody injuring a female urethra, and such a rare scenario is really a miracle if somebody does a urethral injury in a females. So, please remember, easy to put and easy to take in a female patients. So, this is simple. Female Foley's catheterization.
Next, we are going to discuss about the Foley's catheter. Okay, about the Foley's catheter we are going to discuss now. So, there are 2 types of Foley's catheter. As interns, you should know about the 2 types of Foley's catheter. This is latex rubber catheter. Okay, it is made up of latex rubber. And this is silicone catheter. Silicone catheter. So, silicone catheter is little costly and it can be retained even for 2 to 3 months. We can put the silicone catheter and it can remain in the bladder for even 2 to 3 months, whereas latex rubber should be changed every 15 days maximum to 30 days once. So, 15 to 30 days is the maximum time for a latex rubber. Most of you who have completed from government hospitals, you would have seen only latex rubber, but the problem is there is a latex rubber can cause allergy for some people. Silicone catheter does not cause much allergy, okay, but that is major advantage of silicone catheter, but otherwise the function, everything is same, size is same, everything is same, okay. Only difference is the retention period. You can keep the silicone for up to 3 months and latex rubber maximum 1 month only. And anatomy of male urethra you should understand before going to the catheter. So this is a bladder and this is a urethra. So please understand, male urethra is for 20 centimeter length and it is made up of 4 parts. This is penile urethra, this is bulbar urethra, this is membranous urethra, and this is prostatic urethra. This is prostatic urethra. So there are 4 urethras: penile, bulbar, membranous, and prostatic. So we should know, very important, membranous urethra is the narrowest part of these 4. So most narrowest and shortest urethra is membranous. So please don't forget, membranous is the narrowest and the shortest. Prostatic urethra is the most dilatable urethra. Most dilatable urethra is prostatic urethra. So, and most narrowest point of the entire urethra is external urethral meatus. So external urethral meatus is the most narrowest point, so which we will see and put the catheter. So we are now, you have to understand, male urethra is 20 centimeter. So if you see the Foley's catheter, if I pass the catheter, I should ensure the entire catheter should go inside before inflating this balloon. Before inflating the balloon, I should ensure the full catheter is inside. Sometimes what happens in prostatic hypertrophy and all, when I put the catheter, it will be not going beyond this place, it will be coiling here. It will be coiling here like this and it have not crossed, and you inflate the balloon, what will happen? If you inflate the balloon in this place, you will see rupture of this membranous urethra, or even prostatic urethra can rupture and there will be extensive bleeding from the urethra. So one of the commonest cause of urethral strictures is done by interns. When they put the catheter in an improper way, they cause urethral injury. Patient lands up for lifetime trouble. It is going to be a lifetime issue for a urethral stricture. Be careful. When you are going to put a male urethral catheter, you should understand the entire concepts. There are 4 urethras: penile, bulbar, membranous, prostatic. Okay, so now female urethra is not at all difficult to put because it is only 4 centimeter urethra. So just if you put the catheter, it will go inside, but even if it is going inside, inflate it, ensuring the bifurcation is passed. Until the bifurcation is there, you push it inside. Then only you should inflate. Okay. Always put a Foley's catheter balloon inflation once you see the urine coming out. This is another clue. You should put a balloon inflation only you are sure that the urine is coming out. If the urine is not coming out, don't inflate the balloon. That is going to cause more trouble. Okay, don't forget this. So this is a female urethral anatomy. The only difficulty in female urethral anatomy is to identify the urethral opening, because when you examine the perineal area in females, there will be the following holes. Anus, you can find out easily. Vagina and urethra will be seen. Vaginal opening and urethral opening will be seen at the genital area. So you have to identify this perfectly. Sometimes the clitoris may appear like a small hole. So please don't go to the clitoris, you should go to the urethra only. Identify the urethra, which will be usually very small. You cannot even note it unless you expose the vagina with the help of 2 fingers. With the help of 2 fingers, you should splay out the vagina. Then you can find out the urethra, put a jelly and pass it inside. So you will get a urine immediately within 4 centimeters. You will get a urine. So don't get confused with the vaginal opening and urethral opening. So vaginal opening leads to cervix and uterus. So we should not go there. You should go into the urethral opening. And now these are the various types of catheters you are seeing here. This is called as 2-lumen Foley's catheter. This last one is 3-lumen Foley's catheter. There is one more catheter also called as single lumen. Single lumen is also there, which is not used by us in practice. 2-lumen catheter, 1 lumen is to drain the urine. Another lumen is to inflate the balloon. Please don't forget. 2 lumen means one to drain the urine, another to inflate the balloon. Don't forget this. 3 lumen means one is to inflate the balloon, this one, and one is to drain the urine. Another one is for irrigation, bladder wash. Through the other one, I can put fluid, I will wash the bladder and remove the clots from the bladder after TORP surgery. After prostate surgery, TURP surgery. For bladder wash, we use this 3 lumen catheters. So don't forget 2 lumen, 3 lumen. There are 2 types of Foley's catheter we have. And you should never forget the color coding. Especially in Foley's catheter, you should not forget the color codes. So remember, I always used to tell, easy to remember, green is for girls. So girls have a small urethra, so you can use smaller size, that is 14 French. So green is for girls, which is 14 size, 14 French. Orange is for boys. Orange is for boys, which is 16 French. Red is for removing blood, that is 18 French. So there are bigger sizes like 20, 22, 24. Usually we don't use them in humans unless there is a essential stricture being dilated. Some cases we use it, but practically we use in practice only green, orange, red. So green is for girls, orange is for boys, and blood we use red. That is the biggest one we use in practice. 20, 22, 24 and all will not be asked in your exam. They are available in veterinary hospitals for animals. So usually they are not used in humans. Okay. Children, black is for very small babies. So B for babies. Black for babies, it is 8 size, 8 French. And 10 French, 12 French, or there are other colors which are available in smaller sizes. So we have many colors, no need to know everything, but don't forget green for girls, orange for boys. So what is this French corresponds to? What is French? 1 French is equal to, you should not forget, French is outer diameter of the catheter. This is the Foley's catheter means. This is inner diameter of the catheter. This is outer diameter of catheter. Outer diameter of catheter. Okay. So in this, if you understand, if you measure in millimeter, it is 1 millimeter is equal to 3 French. In other words, 1 French is equal to 0.33 millimeters. So French unit corresponds to outer diameter of the catheter. So outer diameter of the catheter. The diameter which is going to go into the urethra is called as outer diameter. So outer diameter of catheter, 1 French is 0.33 mm or 1 mm is equal to 3 French. We call the catheters, intercostal drainage tubes, Ryle's tube, everything in French units. French units is used for many tubes which are used in surgery. Like intercostal drainage tube, we call in French units. Okay, we call it in French units. And Ryle's tube, we call it in French units. So the bigger the French unit, the bigger the diameter. So we should use smaller French one for girls, 14 French. Bigger one for boys, that is 16 French. Red is only for blood removal. So don't forget the basics of this size of the Foley's catheter. So this is how the catheter size can be noted. You can see very classically the 16 French, 14 French, size outer diameter is mentioned here. For understanding purpose, they have mentioned the outer diameter with a French catheter scale. So no need to know in detail, but just remember 14 French and 16 French. So this is one type of Foley's catheter. You can see in this catheter, the tip is bent like this. It is forward is bent like this. It is not smooth. It is bent like this, called as Coddy tip. It is from New Bailey. Please don't forget, 28th edition Bailey has updated what is Coddy's tip Foley's catheter that allows the anterior surface of urethra and never enters the posterior surface. So when I am passing it, this will be curved like this. No? So it will go along the anterior surface of urethra. So this is the urethral anatomy, means it will go along like this. Because most of the time when it enters like this only, we cause the damage of the urethra. So if you have like this, it will safely go into the bladder. Therefore, it is mainly to prevent creating a false passage by perforating the urethra. Many times we can see many interns putting a catheter into the urethra, rupture the urethra and go in a false passage. That and all can be avoided if you use a Coddy tip catheter. Okay, Coddy tip. So now the most important thing is, how will you inflate this balloon? You have now put the catheter, urine is coming out. How will you inflate it? Please don't forget, Foley's catheter should be inflated only with the distilled water. Then only it will remain, if this is the standing position, if you insert in distilled water, it will remain like this in the below and it will drain every urine coming out will be drained like this. If you put air, it will be floating like this. Don't put air, okay? Air will not be helpful. Air if you put, it will not drain the urine. It will float on the urine bladder. Therefore, you should only use distilled water. Sometimes we use normal saline. If there is a delay in using of distilled water, we sometimes use a normal saline. That is going to cause all the problems. So don't ever use normal saline. If you use normal saline, that channel which is getting, that gets salted, it gets crystallized. Because of the normal saline salt, it will get crystallized and you cannot deflate the balloon. So don't use normal saline, use only distilled water. Please don't forget this point. Use only distilled water. By chance, you are unable to deflate the balloon. When you are going to remove the catheter, we have to put a syringe here, aspirate the distilled water fully. Usually we put 10 ml to 15 ml. In girls, 10 ml we inflate distilled water. In boys, we use 15 ml distilled water. So, but 10 to 15 ml is accepted. Remove everything, then only you should pull the catheter out. You are trying to deflate, it is not coming out. How will you remove the retained Foley's catheter? The side channel got blocked. The inflation channel got blocked. How am I going to remove it? It is now under ultrasound guidance is the ideal method. Under ultrasound guidance, put a needle into the balloon. That balloon will leak out the water in the bladder. You can remove it out. So don't do anything else. Like some surgeons used to do overinflation of the bladder and rupture the catheter in the bladder. So what happens if the catheter ruptures inside, the materials will be remaining there and form a nidus for future stones. Therefore, don't rupture the balloon. Just puncture the balloon, take it out. You should not rupture the balloon. If you rupture some tissues, some rubber will remain inside the bladder and will cause future stones. Don't forget this. Always puncture under ultrasound guidance. So what are the places where you should not put a Foley's catheter? Please remember, when should not you put the Foley's catheter? So the most important is a patient developed a blunt trauma or any trauma in the perineum and there is blood at the urethral meatus. Blood at urethral meatus. Please don't forget, there is a frank blood coming out at the urethral meatus with the bladder retention is seen. So when there is already blood coming from the urethral meatus, don't think we have to go and put a catheter. It is mostly because there is a tear in the urethra like this. In a trauma, either like a fracture pelvis or a straddle injury, some injury has happened that is bleeding now. If you go and put a Foley's catheter now, you will cause more trauma here. Please remember, you should never put a Foley's catheter when there is a blood at urethral meatus and the bladder is full like this. So in such cases, I should go for a suprapubic catheter, SPC. Suprapubic catheter should be done in a full bladder with the blood at the urethral meatus. So this is one important place where you should not put a Foley's catheter. Never put a Foley's catheter in these cases. We have to put the Foley's catheter only in the suprapubic level. Suprapubic level we can put a Foley's catheter or a suprapubic catheter is also separately available. Don't put it via urethra. Okay, this is very important point. Don't forget, this is the basics. Okay.